We will discuss the safe injection practices, a high-yield clinical protocol and algorithm. The clinical stakes: needle stick transmission risk 3 to 10% for hepatitis B, 3% for hepatitis C, and 0.3% for HIV transmission risk post-exposure. Risks extend beyond the vaccinator to waste pickers, support staff handling the biomedical waste, and the wider community. So strict protocols are the primary prevention. 11 steps for safe injection algorithm, divided in 3 phases. In first phase, pre-procedure triage and preparation. Step 1, storage and handling. Step 2, vaccine and diluent selection. Step 3, recipient and route verification. Step 4, instrument selection. Step 5, physical examination of the patient or recipient. Step 6, contraindications if any. In the phase 2, the procedural execution is the step 7, administration technique, and in phase 3, post-procedural safety. Step 8 is waste disposal. Step 9, patient observation. Step 10, if any adverse event happens, then handling of the adverse event. Step 11, the documentation of the whole procedure. Vaccine integrity and storage protocols. Remember, heat-sensitive vaccines and cold-sensitive vaccines need to be stored appropriately in the instruments used for storage like ILR, purpose-built refrigerator, double-door fridge. First in, first out, FIFO policy to be implemented. Those vaccines with nearest expiry date received earlier should be consumed earlier. And the cleanliness and hygiene of the storage instrument should be maintained. Vaccine vial monitor, sec test, fridge watch, indicators, thermometer reading should be checked. Physical examination of the vaccines should be done before drawing from the vials. If there is any faulty vaccine found, it would be discarded. If it is cracked or frozen, the vial should be discarded immediately. And do not interchange diluents between vaccines. Open vial expiration timelines. For the multi-dose vials, once opened and kept properly, that can be used within 28 days of opening. After opening a multi-dose vial, date and time should be put within the vial. The septum should be kept clean and needle should not be left in the vial. After reconstitution, rabies vaccine should be used within 6 hours and BCG vaccine should be used within 4 hours and 30 minutes for varicella vaccines. These are the timeline after reconstitution of the vaccine, within which time the vaccine should be used. Clinical triage matrix. Contraindications versus precaution. Strict contraindications should not be confused with precautions. The contraindications where you should not administer the vaccine, like documented past anaphylactic reaction to the specific vaccine or component. It should be documented. And live vaccines should not be given in the severe immunodeficiency patients. And what about the precautions? Precautions should be taken for mild illnesses. Do not withhold life-saving vaccines. In mild egg allergy, influenza vaccines can be still administered. Side effects or decreased immunogenic response may occur rarely, require careful post-procedure observation. Now coming into the equipment selection, standard needle size, which needle to be used for which vaccine, in which route. So for intradermal injection in the newborn in the elder region, we are using the smallest caliber needle and the length is also smallest, 3/8 to 1/2 inch. After that, all the IM injections are discussed here. According as the age increased, the gauge of the needle decreased. Less than 2 year, 23 to 25 age, and more than 2 year children, teen adult, 22 to 25 age. What about the length of the syringe? As in the newborn, we are using the anterolateral thigh, so the length is 5/8. Up to 2 years where anterolateral thigh and deltoid is used. The range increased from 5/8 to 1 inch. Here is 5/8, now 5/8 to 1. And children and teen, where deltoid is used, same 5/8 to 1 inch is used, but the muscle mass in thigh is increased, so the length is increased here 1 to 1 and 1/4 inch. And adults, deltoid area is used and the length is further increased to 1 to 1.5 inch. And now for subcutaneous, all age, all site, 23 to 26 gauge needle like IM needle, but here the length is shorter up to 3/4 inch. Now instrument standards and site examination. Refill syringes have lowest contamination risk. Auto disable or auto lock syringes are preferred because it physically lock post injection. Strict prohibition of red alerts. Do not reuse the disposable syringe. Do not touch needles. Gloves are not strictly necessary unless pre-existing injuries on provider's hand is there. Some pre-procedure exam checklist. Palpate the injection site for muscle mass and inspect skin for any infection, scars, inflammation, induration or nodules. Patient positioning and pediatric restraint biomechanics is very important. If the patient is smaller, the patient should restrain in the mother or father's lap. Caregiver's hand restrain the outside arm and the inside arm tucked against the caregiver's chest, and the caregiver's another hand restrain both the legs. And here is the injection site anterolateral thigh for IM injection. Pain and anxiety alleviation protocol. To relieve pain and anxiety for infants, we can use oral sucrose solution. Breastfeeding or non-nutritive sucking pacifier is also a good option. For older children, topical anesthetics like Imla, Vapocoulin spray can be used. Distraction during injection, stroking adjacent skin can alleviate pain and anxiety. But never give chocolate or any food during or just immediate the vaccination, because there is high chance of aspiration. Now execution protocol. The quick in and quick out method. Step 1. Preparation. Clean with wet swab if the site is dirty. If alcohol rub is used, dry completely before injection. Step 2. Penetration. Jab swiftly. Use the same angle for the introduction and withdrawal. Step 3. No need to aspirate before giving the injection. Step 4. Pressure. Apply sterile dry cotton ball and gentle pressure for the 10 seconds post withdrawal. Step 5. Strict post care. Do not rub or massage the site. No adhesive bandage is needed. Do not recap the needle. Anatomical targeting. Routes of administration and angle of the injection. During intramuscular injection, IM injection, 90-degree angle is used. Deep muscle, apply traction to skin or subcutaneous tissue, and standard specification 23 gauge with 25 mm length needle deep to the muscle. For subcutaneous injection, 45-degree angle with the skin, target is the subcutaneous layer. Grasp or pinch the skin to leave the subcutaneous tissue. 26 gauge, 13 mm length can be used. And for intradermal injection, 15-degree angle with the skin, and target is the between the skin layer. Leveling ends should be upwards and the skin held taut. Standard specification 26 to 27 gauge, 6.35 to 12.7 mm length. After giving the intradermal injection, 5 to 7 mm UD orange whale must form. Thus, you can ensure that the injection given is intradermal. After giving the injection, biomedical waste disposal is mandatory. The golden rule: never recap the needles, immediately dispose or use the needle cutter or burners at the administration table. Yellow bag or bins for the biological products, cotton, soil, linen or expired biologicals. Red bins or bags for general contaminated plastic waste. Black bags or bins for general non-infectious waste. And puncture-proof container, white, for intact sharps and cut needles. It must be leak-proof. Now, post-procedural care, observation and documentation. AEFI and emergency readiness. Mandatory observation period 20 to 30 minutes post-injection. Monitor for allergic reactions or signs of anaphylaxis. You should keep ready your emergency kit with adrenaline, ambu bag, laryngoscope, endotracheal tubes, suction machine, oxygen. Comprehensive documentation must have the log with patient name, vaccine batch number, and exact expiry date. Log the specific anatomical site of injection. It is critical for simultaneous injections. Education: inform the patient or caregiver for expected side effects, home care instructions, and next vaccine schedule. Now the summary points. Angles of the needles. For IM injection, 90-degree angles with 23 gauge needle. Subcutaneous injection, 45-degree angle with 26 gauge needle. And intradermal injection, 15-degree angle with 26 to 27 gauge needle plus well formation post-vaccination. Triage stop indications. If there is past anaphylaxis documentation to vaccination, never give it. In severe immunodeficiency, never give the live vaccines. Vial shelf life. For multi-dose vials, once open, it should be stored properly and used within 28 days. And after reconstitution, rabies vaccine can be used within 6 hours, BCG vaccine can be used within 4 hours, and varicella vaccine should be used within 30 minutes. Never recap needles, never rub injection site, never aspirate syringe. Observation is must 20 to 30 minutes. Always document batch, expiry, and site of the administration. These are the guidelines followed in IAP.